So you might be wondering what a concussion is. A concussion is a brain injury caused by a blow to the head or a violent shaking of the head that causes inflammation.
Most concussions occur in contact sports, such as lacrosse or football, when players' heads collide, causing the brain to slide back and forth forcefully inside the skull. This violent shaking of the brain causes trauma, usually resulting in short-term symptoms. When more severe, inflammation can occur.
So you might be wondering, how in the heck do you even get a concussion? Well, I'm glad you asked. Here are a few examples.
Signs and symptoms, if you may have a concussion, may include, but are not limited to, dizziness, nausea, or vomiting, headache, confusion, or inability to concentrate, sensitivity to light,
Oh my gosh, it's bright outside. Oh!
drowsiness,
Hey, wake up, man. What's wrong?
or excessive fatigue.
If you have any of these symptoms, please report to someone, an authority, or an athletic trainer.
But why?
So the importance of reporting a concussion is so that you can get the proper treatment, because if you don't report it, nobody knows and you can't treat it. And if you don't treat it, then you could get some long-lasting effects like CTE, you could go into a coma, or you could even die. And we don't want that to happen. So please report your concussions.
Repeated blows to the head can also cause CTE, also known as chronic traumatic encephalopathy. What is that, you ask? Let's take a look.
CTE, also known as chronic traumatic encephalopathy, is a progressive degenerative disease of the brain, often found in people with a history of repetitive brain trauma, such as concussions in football. CTE has been seen in people as young as 17 years old, but symptoms do not generally begin appearing until years after the onset of head impacts. Early symptoms of CTE usually appear in a patient's late 20s or 30s and affect a patient's mood and behavior. Some common changes seen include impulse control problems, aggression, depression, and paranoia. As the disease progresses, some patients may experience problems with thinking and memory, including memory loss, confusion, impaired judgment, and eventually progressive dementia.
So there are some ways to prevent getting a concussion or further injury if you do have a concussion. One of the main reasons is to educate yourself on the symptoms of a concussion. Make sure you talk to a trainer if you think you might have a concussion or are positive you have a concussion. And the last one is proper technique during your sport or other activity.